Breast Cancer Awareness Month is observed every October, and it serves as an important time to raise awareness about one of the most common cancers affecting women worldwide. The goal is to educate the public about breast cancer risk factors, the importance of early detection through regular screenings, and the critical needs to support those diagnosed with breast cancer. With more than 2 million new cases diagnosed globally each year, it is crucial to understand that early detection saves lives. We are in University of Uyo Teaching Hospital to find out more about breast cancer.
Breast cancer is cancer which occurs in the breast of a woman. And in Nigeria, breast cancer is the commonest cancer occurring in women. What are the risk factors for breast cancer? Number one, the female gender, being a woman. In more than 99% of cases, breast cancer occurs in a woman. In less than 1%, it occurs in a man. So, that is one of the important risk factors, being a woman. Another important risk factor is the age of the person. Below the age of 20, breast cancer is not very common in a woman. As one gets older, the chances of developing breast cancer with that increasing age increases. Another risk factor is the family history. If one is from a family where other people have already developed breast cancer, then there is an increased chance of that person also developing breast cancer. In terms of that relationship, the closer you are to the index person who has developed the disease, the higher the chance. For instance, if it is a daughter-mother relationship, that relationship is a first-degree relationship, so the chance is high in a mother-daughter relationship compared to a mother-auntie relationship. Another risk factor is a woman who had previously developed breast cancer and was treated. There is still a chance that she can again develop breast cancer either in the same breast or in the breast which was not affected the first time. So, other things that are known as risk is childbirth. A woman who has given birth to children has a lower risk compared to a woman who has not given birth to children. So childbirth is like protective. It protects a woman from developing breast cancer. Other things are diet. Sometimes diet, sometimes drugs can be talked about. The use of alcohol. Use of alcohol increases risk generally for any cancer, whether it is breast or any other cancer. So those are some of the known risk factors. There are others, but these are just a few of them.
Dr. Isaac also mentioned that the right time to begin screening is when a woman reaches the age of 40, adding that women should also perform self-examination at least once every month. He also urged both men and women to look out for lumps, which are the most common signs of breast cancer.
On the average, once a woman is up to 40, it is good to commence screening. Begin to start screening. But if there is a history in the family of breast cancer, then that screening should be started much earlier. So at the age of 30, that such a woman should commence screening for breast cancer. The self-examination, it simply means the woman herself begins to check. Now, she's not checking for breast cancer actually. She's checking for the presence of abnormality like a lump inside her breast. Okay. The best time to check is about a week after her menstruation, when the size of her breast has reduced. That is one. The timing again is, it is best, for instance, when you go into the bathroom to have a bath, then you now use that opportunity to go to examine your breast in a standing position. If the woman stands like you see in that picture, she stands up and uses her left hand for the right breast and the right hand to examine the left breast. So, and she has to go in a systematic order. She doesn't just use the tip of her fingers, but this flat part of her fingers, put it on top, place it on her breast and move round like this. If there is a lump, what she is actually looking for is a lump inside her breast. But she can also take a visual look at her breast, whether there are any changes on the skin of the breast. She examines her breast at least once every month. At least once every month, looking for any changes on the skin of the breast and checking for the presence of a lump inside her breast. One of the commonest problems that a woman develops in her breast is a lump. Most lumps are not cancer. But lump is the commonest way the cancer will present itself.
The medical experts highlighted that the most common test for detecting breast cancer is mammogram, which is a machine used to identify tumors before they can be physically felt.
The main screening test for breast cancer is called mammography. Mammogram. Good enough in Uyo, there are places where a woman can do a mammogram now. So that is the screening test. There are other tests. They may not necessarily be screening tests like this self-examination, or you present yourself for a doctor to examine you. When you suspect that there is a problem, the best thing to do is present yourself to a doctor who will now examine you and confirm that there is a lump in the breast or there is a change. There are some changes in the breast that are of concern. Then the doctor will now know the next thing to do. Mammography actually is a screening test. You do it when there is no symptom, there is no lump in your breast, no skin changes. That's the best time to do mammography. You have no problem. You just want to check, is there anything in the breast that my hands cannot feel or nobody can see? That's the essence of mammography when it comes to screening. Mammograph can quickly see things which nobody can ever see, can see at that early stage. And that is the best time to treat the disease if a mammogram can detect it. Affordability, it depends on the knowledge the person. If the person has his things well of his or her health, then the best thing is to do it.
Dr. Isaac explained that there are specialized treatment teams available to provide support and information about breast cancer.
In terms of support, you can look at it from the psychological aspect of it. You can look at it from the financial aspect of it. Every patient with breast cancer needs that support. You get it? Every patient with breast cancer or any cancer needs psychological, because it has an impact psychologically on a person. The person can get depressed when that diagnosis is made. And once somebody is depressed, that person needs some support. So oftentimes the support comes from the family, because the family has to be there for the person. But in some cases, that's when they may need another person, like a counselor, to work on with the person and give that additional support which the person needs. Because the mood changes. The first thing is the person thinks life is over. So you need to support that person. That life is not over. There is still life to live. So that kind of support. There are support groups. There's a support group here in Uyo, which is called the Cancer Support Group. They talk with the women They come to discuss with the women. Some of the women who have had their treatment for breast cancer, some of them are willing to even expose themselves and say, I'm a woman, you are a woman. Look at me, I've had this operation, I've had this treatment for the past 10 years, nothing has happened to me. So you too, you can have this treatment for the next 10 years, 20 years, nothing will happen. It gives them a lot of support. So there is such a support group here in you. Then there are some people who support them with materials. For instance, prosthesis. Some people, the breast has been taken away. They will give you something that looks like a breast, which you put inside your bra to fill your bra, so that somebody may not appreciate very easily that you've lost one breast. So there are different groups like that give support, but they are very few. But when you compare the number of women having the disease, some of these physical supports may not go round. Occasionally, some people come to support them financially because the cost of treatment is quite high and many women cannot afford it.
He also pointed out that the absence of a radiotherapy machine in the state poses a significant challenge in treating cancer patients and called on the state government to take urgent action.
There are many challenges. Number one is fund. Before you make the diagnosis, you spend some money. After you make the diagnosis, you spend money to treat the patient. And many people see the treatment can be very expensive. That's the truth. The treatment can be very expensive. So, funds for the treatment. And the other challenge is sometimes we may not have the relevant facilities. We have some, we may not have all. We don't have any facility for radiotherapy. Radiotherapy is part of the treatment for cancer, not just breast cancer alone, for many different types of cancers. We don't have any facility for radiation treatment in Akwa Ibom. We have been appealing for a center to be developed. We don't need one center alone. You get it? Based on the number of women who have the disease, we need more than one center to be developed. But at least the state will plead with the government, as much as possible within the limit of the resources available to them, to develop a center which we can take care of women, not just women, other patients with cancers.
The theme for this year, "No one should face breast cancer alone," is considered appropriate given the current challenges faced by those living with the disease. Dr. Isaac emphasized that early detection is critical for survival and the stigma surrounding breast cancer must be eliminated.
The earlier it is detected, the better the outcome. The challenge many women have is we detect it late, at which point the disease has spread to other parts of the body. So it becomes a little difficult to treat. But if it is detected early, when it is limited to just the breast, it becomes very easy to treat. In fact, many people who are treated very early, they live their normal life. They live a normal life without any challenge because they have been treated. And it is considered that we have cured the disease at that stage. So the best thing is, once a disease comes, go for the specific treatment. That is my advice. Many women who are suffering from breast cancer, the disease has spread to other parts of the body, they wasted time in coming to the hospital. People should come to hospital as early as possible when something can be done meaningful for them.
In the Street of Your resident also spoke about the importance of awareness and regular checkups. Many stressed the need for vigilance and support for those battling the disease.
Breast cancer is a type of disease that affects women. Lumps in the breast. It develops gradually, if not taken care of immediately. to grow to a bigger size, which will affect other parts of the body. I know of somebody that had it, and the person was very close to me, which I took immediate action about it. I took the person to the hospital at the early stage, and the lumps was removed. That's why we are asked to always, check our breasts, feel it to see if there is anything like lumps there. If there is anything like lump, you just have to take immediate action. You go to the hospital, do some tests, and get the treatment at the early stage.
Breast cancer is like the name cancer. It's a cancer that affects the breast, especially women. And so for that reason, I will appreciate, because I do it myself. Most women should always go for checkup and also even do the test themselves, because I do it myself. I check my breast if there's any lumps, if there's any cyst or anything. And once they discover that, they should quickly go for the test and then for the treatment. The earlier, the better.
Breast cancer is a disease that can be cured. But a little that I know about the breast cancer, that it started having a little lump from the breast. So as a woman, when you start feeling something like that in your breast, you need to rush to hospital to seek medical advice. Breast cancer that affects not only women alone, but both men and female. My advice I could tell anybody, as long as this life is concerned, whenever you find things that's not normal for you, mostly like women or men, it's better to go for checkup to find out what's the solution to it.
Breast cancer is just basically cancer of the breast. And one of the common symptoms of breast cancer is lumps in the breast. And that's why we always advise for self-breast examination, which is just basically raise your hand on your head, then massage in clockwise direction or anti-clockwise, whichever one you prefer, preferably in front of a mirror. So you can also check for equalness and evenness of the breast. If there's any lump, please come to the hospital. Don't be scared, don't be shy.
Breast Cancer Awareness Month reminds us all of the knowledge, vigilance and support. Whether it's understanding your personal risk, scheduling a mammogram, or offering emotional and physical support to someone fighting breast cancer, every action counts. Screening can help detect breast cancer in its early stages. Together, we can make a difference in the fight against breast cancer. Wang Fon Walter, Spectrum Television.